I'm Amy Olsson. I'm a midwife with Midwifery Care Associates at Simmonds, Martin, and Helmbrecht in Frederick, Maryland. Yeah, the glucose tolerance tests in pregnancy are extremely important because they help to determine any risks that you may be exposed to because of the diabetes, and then how we would manage your care. So sometimes in early second trimester, we need to test you for diabetes with the 1 hour glucose tolerance test, depending on risk factors. But if you don't meet any of those risk categories, then your first exposure to that test would be at 28 weeks. The 1 hour test is just a screening test. It kind of weeds some people out. And based on the result of that 1 hour exam, you would either, if you pass, great, you're not diabetic. If you fail it, then we move on to the diagnostic test, which is a 3 hour glucose tolerance test where you come in fasting and you get your blood drawn before you drink the drink, and then you drink the drink and they draw your blood at 1 hour, 2 hours, and 3 hours. If two of those numbers are elevated above the criteria, then you're diagnosed with gestational diabetes. And at that point, you would meet with our diabetic counselor, and they would discuss diet and exercise that's important for diabetes. You would then record your blood sugars 4 times a day, and you would bring those logs with you to the office so that we could see how your body is responding to your diet changes. If your blood sugars are elevated or they're not, under control, then we would discuss starting you on insulin with the physicians. We show those numbers to the doctors and we come up with a plan. And then you would meet with our diabetic counselor again to learn how to do the insulin injections. And being diagnosed with gestational diabetes, even if you're on insulin, it does not preclude you from midwifery care. You still can be a midwife patient. We just co-manage you with the doctors, and you even can have us for delivery. They just do your manage your diabetes in labor, and we do your labor and birth. So it's wonderful that we have that cohesive relationship with the doctors here where we can co-manage. If you are gestational diabetic, you have one more test to take, and that's around your 6-week postpartum period, so that we can determine if the diabetes has followed you outside of pregnancy. We want to make sure that you're not now a type 2 diabetic and need further care. But that's pretty much the glucose testing that we do in pregnancy. And we do offer at the 28-week visit, we do offer actually any of the glucose testing. You can do something called the fresh test, which has less chemicals, less preservatives, and you buy it online, and you would bring that to your exam, and we would walk you through how to do that, everything before your test. And then also with the LabCorp drink, they provide a drink too, so you can do either one of those, but that's an option for you. So again, I'm Amy. I'm with Midwifery Care Associates and in the Frederick office of Simmonds, Martin, and Helmbrecht. Thank you.